Lifeline, an alternative to hysterectomy. Why aren't more women being told about it? Up next, Lifeline, a less invasive procedure to treat a common woman's health problem. Why aren't more doctors letting patients know about it? On Lifeline tonight, a common problem women facing, fibroid tumors. There's no known cause and few options for treatment. Sometimes surgery can be used to remove the fibroids, but often women are advised to have a hysterectomy. There's also a non-surgical treatment, but not everyone is aware of it. Sometimes the reason for that may be financial.
From ABC News, this is Good Morning America with Charles Gibson and Diane Sawyer, live from Times Square.
And we also have important health alert for women about hysterectomies and an effective alternative that could help avoid major surgery.
When 2020 returns, hundreds of thousands of American women are getting an operation they may not need. Why?
I said that I'm pretty partial to my body parts and I'd like to keep them. I really didn't want any more surgery.
Of the 600,000 hysterectomies done for various reasons on American women every year, as many as 75% may be unnecessary, say some experts.
It was multiple symptoms, bleeding beyond control, pain beyond control. During the day, I had to wing it with 2 or 3 pads, plus an overnight, the super tampon, and literally have stood up out of my chair at my desk and had blood run down my legs.
Yeah. For women suffering with uterine fibroids, it's really important to know that they have options. In the past, a patient might go to their gynecologist suffering with the symptoms of uterine fibroids, namely heavy bleeding, pelvic pain, increased urinary frequency, and were told either to have a hysterectomy if they were not interested in having children, or a myomectomy, surgically removing the fibroid tumors and sewing the uterus back together if they were interested in fertility. And those were the only options available. Fortunately now, we have uterine fibroid embolization. It's a procedure that's completely non-surgical. Patients will come into our facility in the morning and leave that same day. So it's done as an outpatient. The patients have no general anesthesia. The anesthesia is local and IV sedation. They leave the same day with a Band-Aid. So there's no surgical incision, no cutting on you. The recovery period is obviously much shorter. Instead of the 6 to 8 weeks for surgery, it's 4 or 5 days for fibroid embolization. So it's a very safe, very effective, less invasive procedure that will treat the symptoms from fibroids very effectively. A woman can avoid surgery altogether and keep her uterus.
I don't have relief. I am free. Okay? And I'm going to say that again. I am free. Yeah.
Magazine covers and catwalks may be what supermodel Beverly Johnson is famous for, but her new focus is to educate women on uterine fibroids.
These are benign, non-cancerous tumors involving the wall of the uterus. They typically affect 1 of every 3 women, usually between the ages of 30 and 55.
Symptoms include heavy bleeding, pain, and frequent need to urinate. But embarrassment or lack of awareness often leaves women waiting up to a year before seeing their doctor. That was the case with Beverly.
I didn't know enough about uterine fibroids and ended up having a hysterectomy that left me with severe complications. Women need to educate themselves. There's no need to suffer in silence as I did.
Today there are several non-surgical options that allow a woman to keep her uterus.
During my cycles, I started noticing that I would have really large clots, big clots of blood that would come at times, and they were so large that sometimes I could feel them moving.
My worst problem was just such a heavy menstrual flow. I was probably on my period 2 to 3, 2.5 weeks a month.
I had this period that just would not stop. For 21 days, I had my period. Which, at that point, you're like, something's really wrong. And now, psychologically, when you have your cycle for that long, you're just not the same woman.
My period, even though I don't heavy menstruate, but it linger. It's linger on about 3 weeks. So I get a break about a week in a month, and then it start all over again.
Heavy bleeding, a lot of cramping. There were times the flows were so heavy that I couldn't even go to work.
I was at a jazz concert in Greenville with my fiance, and we were standing in a huge crowd of people, and you know, I was very diligent when I was on my period, but I had been out there for about 10 minutes, and we were sitting on the rock wall, and suddenly I just went, oh my gosh, and I was surrounded by people, and I told my fiance, I said, I think I just bled all over my skirt.
I endured through to probably the point where I'm now wearing Depends because my flow is so heavy. I'm not only wearing Depends, but I'm also wearing 2 overnight pads because I'm now flowing through my clothes.
The periods were just outrageous. I mean, if you have to wear 2 pads at a time, your period's out of control. You know, if you have to sit on newspaper because you're always soiling your clothes, it's out of control.
So I went to go get an ultrasound, and the test came back and showed that I had fibroids in my uterus. I was a little discouraged. I didn't really know much about it, but I went back to my primary care doctor, and she referred me to a specialist.
My gynecologist told me that I had what was called a fibroid, and at the time I didn't know what that was. I didn't know what it meant, but he told me that I needed to get it removed.
She said, well, your choices are a myomectomy or a hysterectomy. And I said, those are my 2 choices. She explained both procedures to me, would put me out 6 weeks, but said there's really no side effect. You do not need your uterus if you do not want to have children. And I was not happy about it, but I went, well, might as well go ahead. Well, I went home, and about a week later, I went ahead and scheduled my surgery. And the whole time I kept on going online thinking, I can't believe that I'm going to have hysterectomy on the same year I'm getting married, and I'm going to have to hurry up and have it done because I want to be okay by my wedding in October.
She offered me the option of another myomectomy or a hysterectomy because at the time I had no plans to have any more children. But with my history with the myomectomy, I definitely did not want to do it. With the hysterectomy, I knew of women who had hysterectomies at younger age. That time I was about 34, who were now on hormone replacement therapy and had a whole host of other issues because of that.
I'd asked my OBGYN several times. Actually, I talked to her on the phone 3 times and talked to her in the office. Is there any other option for me? And she said no. She said it's a hysterectomy or myomectomy. I'm like, no other option.
And of course, having a meltdown that the doctor wants to take my uterus, I don't understand why I'm going through this. And one of the ladies that was in the group basically says, have you ever heard of UFE?
2 weeks before my scheduled surgery, I found Dr. Lipman's website, and I read all about it. It seemed amazing, almost too good to be true to me. But I went ahead and made an appointment, and I came on down and had my MRI, and Dr. Lipman saw me immediately after my MRI, same day.
After finding out, the size of the fibroids and what we could do, I was just tickled. I said, let's schedule it right away, because I'm one of those people that wants to get it done. And I had my UFE in December of 2005, and I have not had any trouble since.
I can tell you that I felt the difference immediately. My stomach had that little pouch. Ladies, how you want to have a nice little flat stomach. I had a little pouch. I looked like I was a little pregnant, even though I wasn't. I immediately saw a difference. My stomach was flatter. When I had my first menstrual cycle, it was 20 times, 1,000 times different. I suffered from very heavy flows. I got really embarrassed because I would have those little oopsies. You sit in a chair, you have the little accidents. Never happened again. My cycle started, it was normal. I was always been normal.
So it's been an utter godsend to the place that, I'm not anemic anymore. I'm not eating ice anymore. I have a normal life. My cycles are normal.
It gave me a renewed sense of life that I do have this opportunity. And even at 42, it was better than just giving up and having a hysterectomy, which I knew I was never going to do. So now I feel like I'm 11 months free, I guess.
My life has changed too, because I can't even believe that I have not one symptom, nothing. My period is about two days a month, and it's regularly scheduled, and it's just too good to be true.
I was able, me and my husband, we were able to make love again without me screaming. But I would recommend this to everyone. I don't believe a woman should take what belonged to them as a womanhood. I think they should treasure that. They should try to keep that as until they're no longer on this earth. For me, that's what's very important. I did not want to have anything removed from me.
Don't give up and just decide to live with the heavy cycles. Don't give up and say, this is the way it was for my grandmother, my mother, my auntie. I later found out, because my family's not a family that talks about medical history, I found out my mother and my grandmother had fibroids. Not that they shared that with me, but, I found out after I was in the throes of it. So it's important now for me to tell my young daughter and to watch and to help her take control and keep control of her health, because UFE was a real solution. And when you get real solutions, I think your life is so much better.